Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, diagnosis of ureteric injuries. So, if the patient has ureteric injuries, how are you going to diagnose him? The diagnosis of ureteric injury is rarely made until the swelling of the loin or iliac fossa is seen along with ureteric output. See, because most of the cases of unilateral ureteral fistulas, unilateral ureteral injuries have no symptoms because the other kidney is functioning completely normally. So there won't be any compromise because other kidney will function to its full extent to compromise the decreased function of this kidney. So as a result, symptoms are absent unless there is some infection or there is fistula formation. So as a result, diagnosis is made only and only or when uh, it is made when there is swelling in the loin. Diagnosis is made by swelling in the loin or iliac fossa with decreased urine output. So, in these cases, for diagnosis, we can use an excretion urogram or CECT can be done. In CECT, if you do a CECT, obviously there is an injury to the ureter. So, if you pass a contrast dye from the ureter from the kidney into the ureter and into the urinary bladder, then this dye starts to extravasate and it reaches the abdominal cavity or pelvic cavity. So this is contrast enhanced CT scan. So with the help of this extravasation, we can find out the ureteric injuries. Then treatment of ureteric injuries is, in the ureteric injuries, treatment is by early repair is important. Early repair can be done if the patient is fit for surgery and if we have diagnosed it at the time of the surgery itself. Early repair is the best.
thank you and thank you for watching.